Hey everyone, welcome to Vetology, where we break down veterinary science in a way that actually makes sense. I am Sivasubramanian, a fourth year BVSC student, and today we are diving into a topic that's super fascinating and clinically important: pseudopregnancy in canines. We are going to cover the causes, pathophysiology, diagnosis, and treatment. Everything you need to know, so let's get into it. So, what exactly is pseudopregnancy? Imagine this: a dog that has never mated, never conceived, yet starts showing all signs of being pregnant. Swollen mammary glands, milk production, nesting behavior, and the rest. That's pseudopregnancy for you. Also called phantom pregnancy or pseudocyesis. This can happen in any intact bitch, not just a few unlucky ones, because the hormonal changes that trigger pseudopregnancy are actually a normal part of the estrous cycle. Specifically, it kicks off during the diestress phase when progesterone levels fall and prolactin starts to rise. That prolactin surge is what drives all those pregnancy like signs. So, in a way, every non pregnant intact bitch is a potential candidate. Clinically important point, remember this. Alright, now let's understand the why behind this. And I promise, once you see the logic here, it will stick with you forever. So, after ovulation, the corpus luteum forms and starts producing progesterone. In a pregnant bitch, this progesterone supports the pregnancy all the way through. But in a non pregnant bitch, around the 60-day mark, which coincidentally is roughly when gestation would end, the corpus luteum regresses and the progesterone drops sharply. Now, here is where it gets interesting. The pituitary gland reads that progesterone drop as a signal that, hey, pregnancy is over. That's time to produce milk. And it responds by ramping up prolactin secretion. And prolactin doesn't just drive milk production, it also triggers that classic nesting behavior you would see in a bitch that just delivered puppies. So, the bitch's body is essentially going through the motion of the postpartum period without ever having been pregnant. The hormones don't know the difference. That's the core mechanism right here. Progesterone drops, prolactin rises, and the body responds accordingly. Now, let's talk about what you will actually see in the clinic, the clinical signs. And these are broadly divided into physical changes and behavioral changes. On the physical side, you will notice mammary gland enlargement, milk secretion, and sometimes even abdominal distension. These signs typically appear 6 to 12 weeks after estrus. So always ask the owner about the heat cycle timing. On the behavioral side, this is where it really gets striking. The bitch starts nesting, gathering, and mothering inanimate objects like toys, becomes restless, may go off food, and can even become aggressive if you try to take away her puppies. Some owners come in genuinely convinced that their dog is pregnant or has just delivered somewhere. That's how convincing these signs can be. Less commonly, you might also see weight gain, vomiting, diarrhea, polyuria, and polydipsia. So keep those in back of your mind too. So, how do we confirm pseudopregnancy? Honestly, diagnosis is primarily clinical. You take a good history, observe the signs, and you are most of the way out there. But the real skill lies in ruling out your differentials. Your big four differentials are true pregnancy, pyometra, mastitis, and hypothyroidism. And you absolutely cannot miss pyometra. It can be life threatening, so always rule it out. To rule out pregnancy, ultrasound is your best friend. Quick, non invasive, and definitive. Radiography can be used later in distress when fetal skeletons are visible. Relaxin assay is another option. Relaxin is only produced during true pregnancy, so a negative result strongly supports pseudopregnancy. For hypothyroidism, thyroid hormone levels will help you there. So put it all together: history, clinical signs, ultrasound, and you have got your diagnosis. Now, for management, the first thing to know is most cases of pseudopregnancy are self-limiting. They resolve on their own within 1 to 3 weeks. So sometimes the best treatment is reassurance to the owner and some simple supportive care. Conservative therapy focuses on reducing prolactin stimulation. First, slightly reducing water intake, that is from night 7 o'clock to morning 7 o'clock for 5 to 7 days. Helps by reducing the substrate available for milk production so the water is absorbed for other bodily purposes. Put an Elizabethan collar onto to stop the bitch from licking her mammary glands. Tactile stimulation stimulates more prolactin, which means more milk. You want to break that cycle. Now, here is something really interesting that you won't find in every textbook. A traditional topical application that works surprisingly well. A mixture of kaolin acetate, glacial acetic acid, and water can be applied as a thin layer over the mammary glands once a day. Kaolin acetate here acts as an adsorbent. It absorbs the secretions from the mammary gland surface, reducing stimulation and discouraging further milk letdown. Think of it as a drying agent for the glands. And if that's not available, there is an even simpler alternative. A mixture of a piece of chalk, a drop of lemon juice, and water applied the same way. Same principle, the chalk acts as a mild adsorbent, and the acidity from the lemon helps reduce secretion. Simple, cheap, and effective. Exactly the kind of practical knowledge that comes in handy in the field. And if mammary engorgement and fluid retention are significant, diuretics can be used to help. Furosemide is the go-to here. It promotes fluid excretion and helps reduce mammary swelling and engorgement. And if the bitch is showing significant behavioral signs, light tranquilization with non-phenothiazine drugs can be considered. And that non-phenothiazine part is important because phenothiazines actually stimulate prolactin and will make things worse. When conservative therapy isn't cutting it, we move to therapeutic management. And historically, quite a few drug classes have been tried here. So let's go through them one by one. First, set steroids. This includes estrogens like diethylstilbestrol, progesterone derivatives like megestrol acetate, and androgen derivatives like testosterone. These work because high doses of set steroids exert a negative feedback effect on the pituitary, inhibiting prolactin release. Sounds good in theory, but in practice, they come with serious baggage. Estrogens can cause pyometra, bone marrow suppression, and signs of proestrus. Progestins like megestrol acetate carry the risks of diabetes mellitus, cystic endometrial hyperplasia, and even mammary tumors with long-term use. Androgens can cause clitoral hypertrophy and virilization. Because of all these side effects, set steroids are largely avoided nowadays and are considered outdated management. Second, ergot alkaloids. This group includes bromocriptine, gabergolin, and metergolin, all of which work as prolactin inhibitors. Bromocriptine was one of the earlier drugs used at 0.01 to 0.1 mg per kg orally for 5 to 7 days. Effective, but causes significant vomiting, anorexia, and depression as side effects, limiting its use. Metergolin is another ergot alkaloid at 0.2 mg per kg orally for 8 to 10 days. But it can cause anxiety, aggressiveness, and hyperexcitation, which is the last thing you want in an already distressed animal. And then came gabergolin, the game changer. At just 5 micrograms per kg body weight orally for 5 to 7 days, it's a highly selective dopamine D2 receptor agonist. What that means practically is it is very precisely targets the receptors that suppresses prolactin with minimal off-target effects. Fewest side effects, best tolerability, and most reliable results. That's why gabergolin is the first drug of choice for pseudopregnancy management. If someone asks you in an exam, drug of choice for pseudopregnancy, the answer is gabergolin. No second thoughts. Now, surgical management. Ovarian hysterectomy is the only permanent preventive solution. But the timing of this surgery is absolutely critical. And this is something many people get wrong. Here is the logic. The estrus cycle has four stages: proestrus, estrus, diestrus, and anestrus. Now think about what happens hormonally at each stage. During proestrus and estrus, estrogen levels are high and the follicles are active. Not the right time to operate on the reproductive tract due to excessive bleeding. During diestrus, the corpus luteum is fully active and progesterone is at its peak. If you remove the ovaries now, you can cause an abrupt and sudden drop in progesterone, which the body interprets as gestation has ended, and it immediately triggers a surge in prolactin. Result: you have just induced an acute episode of pseudopregnancy through surgery. That's the last thing you want. So, when should you do it? During anestrus. The quiescent phase, when hormone levels are at their basal minimum, there is no active corpus luteum, no surging progesterone, no follicular activity. Removing the ovaries during anestrus causes no sudden hormonal shifts, and the risks of triggering pseudopregnancy is essentially eliminated. Clean surgery, clean recovery, permanent solution. Let's bust some myths as because these come up a lot even among pet owners. 1. All pseudopregnant dogs produce milk. False. Not every case involves lactation. Some bitches only show behavioral signs with minimal or no mammary gland changes. 2. Spayed bitches can't have pseudopregnancy. Actually, they can. If they were spayed during the luteal phase, the sudden withdrawal of progesterone can trigger an acute episode of pseudopregnancy. Clinically, very important. It needs treatment every time. Not true. Mild self-limiting cases don't need medical intervention at all. Treatment is reserved for severe or persistent cases. Before we wrap up, I want to leave with you something that genuinely changed the way I look at this condition. And it came from a question my VGO professor asked me during my ward presentation where I presented the case of pseudopregnancy. She asked, why is pseudopregnancy actually beneficial, especially in the wild settings? And honestly, I didn't have an answer then. But her explanation stuck with me, and I think it will stick with you too. We have been talking about pseudopregnancy as a clinical problem, something to diagnose and treat. But zoom out for a moment and look at it from an evolutionary perspective. Pseudopregnancy is not just a domestic dog phenomenon. It's seen in wild canines, wolves, African wild dogs, does, and even in wild felids. And in those wild settings, it serves a remarkable purpose. Picture a wolf pack. A litter of pups is born to an alpha female. But then something happens and the mother is injured or dies or is simply unable to produce enough milk. In the wild, that would normally be a death sentence for the pups. But here is what nature's backup plan kicks in. Another female in the pack who happened to ovulate around the same time but didn't conceive is now in pseudopregnancy. Her prolactin is elevated, her mammary glands are developed, she can nurse those orphaned pups. So, pseudopregnancy at its core is nature's way of ensuring that there is always a backup lactating female available in a social group. It's a survival mechanism, a biological safety net hardwired into the canine reproductive system over millions of years of evolution. And that realization completely reframes how you think about this condition. It's not a glitch in the system, it's a feature, a beautifully designed one. So, the next time you encounter a pseudopregnant bitch in your clinic, yes, treat the clinical signs, manage the discomfort, but also take a moment to appreciate that you are looking at millions of years of evolutionary wisdom playing out right in front of you. The content in this video is based on our class notes, Robert's Veterinary Obstetrics and Genital Diseases, a classical textbook you should all have, and a 2018 review article by Singh et al. On canine pseudopregnancy and its treatment strategies. And that's a wrap on pseudopregnancy in canines. I hope this video made the concept crystal clear. If you have any doubts or questions, drop them in comments. If you have any suggestions for me to improve, leave them in comments too. And give me suggestions for topics you want to discuss in the subsequent videos. If this helped you, hit that like button and subscribe to Vetology for more veterinary content like this. See you in the next one. Bye.